primarily this week we're working in hotels for the homeless in Melbourne inner city.
And why use people who were previously homeless to help you do this?
Yes, well, our teams consist of a nurse immuniser, a nurse vaccinated, an administration person, and a social worker and a worker who has lived experience with homelessness, and they are able to connect and communicate with the vulnerable communities on a level that perhaps some of us have not experienced or are not able to, and they've been pivotal in engaging in these communities and getting them on board and vaccinated.
We know that trust and access are two things that are critical in the vaccine rollout. Is that what you're finding as well?
Totally, yes. We're engaging with the communities. There've been, communications put out, but sometimes it's quite a transient community as well. So people who may be there 1 week might not be there in 3 or 6 weeks when we return for the next dose. But we're aiming to vaccinate as many people as we can.
So how do you find them if they're not in the same location as they were when you gave them the first dose?
Well, that's the challenge, really. And some people will have their phones lost or stolen, and that is the ongoing challenge. We let them know where to access the vaccine at our various pop-up sites when we give their first dose, and we also offer our West Melbourne hub as an access point for them as well. And we let them know that we will be back in those locations and the dates and times that we're available.
Are you encountering much vaccine hesitancy, or are most people willing to get the jab?
Look, I don't think we've seen any difference in hesitancy in the homeless community as we do in any other community. I think most people have some sort of concern or not. So it's not really something that we've encountered any differently anywhere else.
You're a not-for-profit. It sounds like this is quite an intensive exercise. Do you have the resources to do what you're doing on an ongoing basis?
Yes, look, the Department of Health, as I said, are funding us, but we are also accessing our current resources in terms of a mobile van. It's the Green Cross bus that we use to go out to the homeless hotels, and we'll be going out to caravan parks and other facilities as well, and using that resource, and our teams of vaccinating nurses and admin support staff, as well as the social workers and peer workers.
And how important is this work that you're doing for people who find themselves sleeping rough that they are vaccinated, because they're at high risk of contracting COVID-19?
That's true. So, for instance, we had a story of a lady who popped into one of our clinics the other week. All of her possessions were in a shopping trolley. She came in for a chat. She spoke to the nurse. She received the vaccine and then went on her way. But the following day, 3 more of her friends came along and were vaccinated as well. So it is word of the mouth, and they are a community. They do know each other. They know where other people sleep, where they reside. So I think that's really important in engaging with them on that level and just communicating, letting them know where we will be next.